Fixation of an olecranon fracture with the Medartis APTUS elbow 2.8 dorsal olecranon plates by Dr. Raul Barco, Spain, and Dr. Konrad, Germany. Anatomical landmarks and approach. We start with the palpation of the olecranon, followed by the triceps and the ulnar nerve. The incision should not run over the olecranon. The incision line should be slightly curved. Cut through the incision line and expose the first layer of soft tissue. Expose the tissue around the ulnar nerve to ensure visibility and thus prevent injury. This is the olecranon. This is the bone root. Expose the second layer of soft tissue. Plate selection and positioning. The dorsal olecranon system consists of 3 different plate types depending on the fracture of the olecranon. The standard, medium and extended. Each type is available in different lengths. This case, we will go with the standard version. Angulation of VA. Angulation of PUDA. End of the plate. Check whether the plate adapts correctly to the anatomy. Here you can see that the plate needs to be bent a little bit extensionally. Bending of the plate. To bend the proximal ulnar dorsal angle, slide the plate through the corresponding slot. While bending, the plate must always be held at 2 adjacent holes to prevent contour deformation of the intermediate plate hole. Do not bend the plate by more than 30 degrees. To bend the varus angle, use the opposite side of the bending irons. To increase the varus angle, ensure that both tips of the bending irons point outward. Use both hands to adjust the angle to your desired position. Fixation of the plate. Prefixation of the plate to the bone with olive K wire. First, fix the plate in the oblong hole with a cortical screw. Fixate the end of the plate to the olecranon. The coronoid is behind here, and the dorsal olecranon system offers multiple fixation options to stabilize the coronoid. Screw A. Crosses from the lateral plate rim to the medial side of the coronoid, sublime tubercle. Screw B. Courses from the lateral plate rim to the center of the coronoid. Screw C. Courses from the medial plate rim to the lateral side of the coronoid. Use the 2 options for retrograde screws aiming into the olecranon tip for additional tip fixation if required. Tri-Lock Plus allows for 1 mm compression and angular stable locking in one step. Before using a Tri-Lock Plus hole, ensure that there is no fixation on the Tri-Lock Plus side, and fix the plate with at least one Tri-Lock screw on the opposite side of the fracture or osteotomy line. If you tighten the locking screw and want to apply compression, the cortical screw must be loosened. You can see how the fracture gap closes by locking the Tri-Lock screw. The cortical screw can now be tightened. Closure. Close the pocket with Vicryl 2.0.